All right, here we go. You ready?
Yeah, I'm ready.
Hello, and welcome to another exciting episode, Living Well Together.
Big life in a small town.
Why don't you share an intro with us for our guest today?
Well, I have a really great one right here if you'd
Let's
like.
have it.
Okay.
Yeah.
So we're joined today by a local expert who's making a big impact right here in the Dayton area. He's a physical therapist and the clinic director at Xcel Physical Therapy in Fairborn. He's passionate about helping people move with confidence, overcome pain, and truly understand what their body's trying to tell them. Please help us welcome Scott Blackburn.
Ta-da! It's Dr. Scott, am I right?
Correct, yes.
Yeah, so you're a doctor of physical therapy.
That is correct, yeah.
Which is different than a regular physical therapist. How?
So most physical therapists now will have their doctorate.
Okay.
So within the last 15 to 20 years, it changed from a master's of physical therapy to a doctorate. So you may still see some older physical therapists practicing.
You know how those old people can be stuck in the past.
Right, yeah, right. But their so their credentials will be their name and then MSPT, but ours now are DPT.
Got it.
So most physical therapists you see now are doctors. With it being some people are doctors, some people aren't. Some companies don't refer to their physical therapists as doctors because it can get confusing if they have some like we do that are still a master's. So we don't refer to ourselves as doctor in the clinic.
I'll cut it out. We can snip that part out.
But I always tell people I am a doctor of physical therapy, so there's not that confusion for them. So
is it non-prescribing then?
Yes, correct. So some states allow physical therapists to prescribe meds or order imaging.
Diagnose conditions.
Yeah, things like that. Ohio is a little behind on that, but we can do some other things that some other states can't do, like dry needling, for example. That's one of those things. So,
ooh, I didn't know you did that.
Yeah. So
speaking of Ohio, tell us a little bit about you. Where'd you grow up?
Yeah. So I am from pretty locally. I grew up over in Springfield, just north of Springfield. I went to Kenton Ridge High School. And so
What was the mascot at Kenton Ridge?
Kenton Ridge Cougars.
Hello. See, we're getting boom, immediate viewership.
Yeah, absolutely. But then I moved over here to Fairborn once I started my undergrad at Wright State. Got my undergraduate degree in neuroscience from there. Went to physical therapy school at Dayton. And so my wife and I, we lived in Fairborn for probably 7 or 8 years when we were finishing up school, kind of getting started in our careers. And then we just recently moved back to where I'm from. My wife's actually an elementary counselor at the school I went to school.
Okay.
So we live 2 minutes from the school now.
That's crazy.
Yeah.
Wow.
So kind of full circle there. So
No
I
kidding.
have to say, and we got to have her on maybe next.
Yeah.
My elementary school counselor changed my life.
yeah, well,
In a
that's
good way?
Oh yeah,
She'll
Mr. Van
she'll
Boris.
love to
We've
hear
talked
that.
about him before.
Yeah.
I actually wrote him a letter, and hey, dude, thanks for keeping me out of jail.
That's important.
Yeah. Good
Well,
things.
you mentioned neuroscience. So you started with neuroscience and then moved into physical therapy after that?
Yeah. So when I went to Wright State, I originally thought I wanted to do pre-med. So I actually started in biology. Wright State created a neuroscience program. I switched into that.
Yeah.
And then the reason I got into PT, it's not a very exciting story. I had an injury myself.
Yeah.
Wright State has a cadaver lab. And so I was in the anatomy cadaver lab. One of the cadavers had a knee replacement. And I was like, that looks pretty cool. Oh, wow. And so I emailed my advisor.
Outlast the rest of them.
Yeah. And so I emailed my advisor and I was like, hey, what if I switched to PT? What would that look like? He's like, oh, that'd be no problem. You could do that. And I just, without knowing anything about PT, I switched and here I am now. So,
Interesting.
yeah.
That is so interesting because it feels like a bigger shift from neuroscience.
Yes.
But
so I thought the same thing.
body.
But as I practice more and I learn more, there's quite a big connection between the nervous system and how we operate in pain and things like that as well. So I use a lot more of those concepts than I originally thought I would.
Yeah.
And even the educational portion of that, there's a ton of crossover.
Oh, yeah.
And just in the course curriculum.
Yes, absolutely. I don't specialize in neuro patients in my everyday clinic, but I do see patients with MS every now and then, or patients with gait and balance disturbances or issues like that, that those past backgrounds and knowledge of neuroscience really helps me treat those patients a little bit better.
Yeah.
So
that's incredible. So did you go to the University of Dayton? Is that what you said? Okay.
Yes. Yeah. So that's the big PT school around Dayton. So I know there's quite a few PTs that go to Dayton that still practice in the area. So if you've been to PT around Dayton, you've probably seen a PT that went to UD. So we're a little proud about being at UD, but the program's great there. So
and then is that where you did the doctorate too?
Yes.
Oh, nice.
So
okay, so everything finished up there.
Correct. So I did my undergrad, my bachelor's degree was from Wright State. So you got to get your bachelor's degree and then you go into the 3-year doctor of physical therapy program. So yeah.
Did you and your wife meet at Wright State?
So we knew each other way back in like middle school. I always had a crush on my wife all growing up through like middle school and high school. She knew it definitely, but, and then by the time we both ended up at Wright State eventually. And so we kind of started talking more there, started dating when we were, I think, sophomores at Wright State, and then got married a few years after that. And now we're got a house together. We got no kids yet, but we have a dog that basically is like our kids. So
of course, what kind of dog is it?
He's a lab, so he's a handful.
Cuddly.
Oh yeah, but yeah, we love him. So
that's awesome. And you are actually living back in northern Springfield right now?
Yes.
Okay.
Yep. So we live just outside the city limits north, couple of streets over from where I grew up. So like our family's all really close. So it's been good.
That's perfect.
That is so nice.
How'd you pick the location for your clinic? Did you join somebody? Did you associate with somebody and then decide to open your own shop?
Yeah. So I'm part of Xcel, like you mentioned. So we're based out of Vandalia is our main location. We have 4 locations around the Dayton area. We've got Vandalia, Beaver Creek, up north in Anna, and then the Fairborn location was the 4th. So I am not necessarily like the owner of the clinic. I'm what we call like the clinic director, right? So I run the day-to-day operations. I still do quite a bit of patient care. And so we chose Fairborn because we were looking for, hey, we want to expand our footprint. We want to help more people in the area. Fairborn had a pretty big need for physical therapy. There's not really a whole lot in this area.
Agreed.
And so, I mean, it's showing already. We've only been there 6 months and we're already ready to start to bring on a second therapist, and we're growing really quickly.
You've only been there for 6 months? Oh, wow. That's phenomenal.
Yeah.
And you guys met because you popped in here, right?
Yes. So
that was so brave.
Yeah. So after just a couple
He beat
months,
me to it though. I saw the sign. I saw your neon, and I'm like, oh, I got to drop.
Yeah, we had the same idea. We had the same idea, but yeah, I'd been meaning to come over here and stop by after we got kind of settled in. I just was like, hey, just wanted to see what you guys are about, see if I can send some of my patients to you. And then he was like, well, great, I had the same idea. So we kind of exchanged information. He showed me around here, and then I just recently brought him over to our clinic, and we ran through some stuff that we offer as well. So it's been good.
And I've already got 3 or 4 people in his shop.
Oh, really? Yeah. So, but it was pretty fun because it wasn't like your standard PT appointment, right? Because
not
you
that
focused
part of it.
on...
Yeah, not that part of it.
Do you want to talk about your experience?
Well, one of the things, tell us about your title is Performance Institute certification.
Yeah, for sure.
That separates you from a lot of the pack, I would think.
Yeah. So most of my day-to-day stuff is, general outpatient orthopedic stuff. But then, like you mentioned, the Titleist Performance Institute certification I have, or TPI for short. I got that a couple years ago. I'm a big golfer myself. I love to golf. I love to treat golfers. So essentially what that is like a full body screen. We assess head to toe how every area of your body moves independently of one another, but then also in conjunction with the surrounding areas. And we use that information to kind of come up with a plan that's specific to each individual golfer. So Titleist believes there's not one golf swing that everyone should use. There's one golf swing that's best for you and your body and how your body moves. So then we have to identify, well, what limitations do you have in your body, and how is that going to affect your swing, and how can we address those to help you swing your swing more efficiently, not in as much pain and that sort of thing.
Yeah,
so
that's cool.
Yeah. So I love doing it. I've done a lot of different things with it, from just seeing patients in the clinic to going out to high schools and, doing stuff with them and their golf teams.
Okay.
Yeah. So
so nice.
It gives us a lot of options to be really specific in physical therapy or go a little bit more broad and do more golf performance and enhancing their swing and that sort of thing.
Yeah.
So you ran me through it, and I'll just tell you right now, I was a little bit embarrassed.
Embarrassed?
Well, because you're looking for restriction or limitation in mobility and function. One of the things I was most embarrassed about was my balance. Like, how long can you stand on one foot? Apparently the answer is not very long.
Were your eyes closed or open?
It doesn't really matter. It's way harder with your eyes closed though. My point is it reveals some weakness in your whether it's your posterior chain stuff or whether it's just overall body balance. It lets you know right away, like, here's where you suck and here's where you're okay. And
Yeah.
and then we got some exercises that we can use to work on expanding my thoracic mobility and my hip mobility and some of that stuff. So and what did that take? Half an hour?
Yeah, if that. I think usually I spend about an hour with everybody because it's that half hour is like, let's screen your body.
Right.
And then I like to teach you about it. And here's what we found. Here's what we're going to do about it. So then it takes a little bit of time to go through that as well. But yeah, the screen itself is really pretty quick. So.
Swing video. You're swinging a makeshift golf club. And so we're getting video from front and side. And here's where I look really good. And here's where I probably shouldn't do that.
What are some of the most common issues that you see with the golfers?
So number one, most common thing, hands down, is low back pain. That's what I get a lot of. Even patients that come to me for back pain, and then it just comes up, oh, hey, this actually hurts most when I golf. I'm like, well, lucky for you, I treat that. So, but low back pain is probably the most common thing. And like Terry and I talked about when he came to see me, it's usually not from like the low back. It's usually from hip mobility or thoracic mobility. It's those surrounding areas that, okay, they start to run into some issues when the other areas around it aren't moving. So the low back starts to work a little bit harder than it should. So usually people are surprised when they see like, oh, I'm actually limited here, not in my back.
Yeah.
We got to work on some other things to kind of help support the low back in a roundabout way.
And I've always heard there are two kinds of golfers, those with lower back pain and those that don't have it yet.
Yes, I would say that's accurate. Oh yeah, for sure.
Over the course of time. And you're right, it has to do with compensatory changes in other joints that end up putting more wear and tear in your lumbar spine than they should.
Yeah.
Did you get to go somewhere fun to do this training for the Titleist program?
Unfortunately not. It was all online.
Oh, shoot. I was thinking you're going to Florida, or Arizona.
I think they're based out of California.
Oh, okay.
They do offer like some live seminars and things that I've thought about going to at some point. So as I get more into it, and because they have different, I'm like a level 1 expert is what they call it, but they have more like in-depth, so like fitness or medical or things like that,
gotcha.
that I've thought about going down a certain path, but I've only had the certification for a couple years. So I'm kind of feeling out like what would be most beneficial to really specialize in before I decide to do something like that. But hopefully I get to go somewhere.
I know,
somewhere
that would
cool.
be super fun. Yeah. So once you do the evaluation, what's the first step towards quote unquote fixing them?
Yeah. So as part of like that initial appointment, there's an app that I have access to as the TPI professional, and then the patient also gets access to.
Oh, nice.
So what I can do is I can communicate directly with everybody through that app, set them up with a specific routine of exercises for them, range drills for them to do if they're out at the driving range, they want to hit some balls.
Yeah.
I want to work on this part of my swing. What should I do? I load it into the app for them. So it's all in there, and we can make it as comprehensive as they want. If, hey, I'm retired, I'm going to dedicate an hour or 2 hours a day to doing this.
Wow.
Okay, great. We can fit that. Or, hey, I'm a dad, I've got a job, I can maybe 10 minutes of my day. Okay, we can make that work too. So
that's awesome.
Customization.
Absolutely.
That I think that is just so clever. Did you get the app?
I got the app.
And honestly, the hardest part of the first visit is getting the app set up. That takes probably the longest out of anything.
Especially when you're really super tech savvy.
And you love it so much.
Yes.
He loves it so much.
They don't have an Amish app. At least not yet. But no, and I have to admit, the week that I did my evaluation, I was flying
getting
to
ready to
Minneapolis.
leave. Yep.
So,
and then you traveled again after that. No, I think you were going on your little DNA getaway.
Right. So diligence is not my strong suit so far with my exercises and my app.
We'll get there. We'll get there.
So then does he come back in and you do more in regards to golf or just overall PT?
Yeah, so it depends on the person. So doing the Titleist evaluation gives us a lot of freedom I've seen patients where they come in, we identify some things and they're actually like, hey, this kind of bugs me actually, or I've noticed, maybe not when I golf, but just in my day-to-day life, I have some pain here. So, okay, hey, let's get you on the books for let's have you become a patient of mine for physical therapy.
Right.
And then we tie those Titleist aspects into their treatment plan. So, okay, we want your back to not hurt when you're lifting up your grandkids, for example. But let's also make sure we tie those golf aspects in so it doesn't hurt when you're on the course.
Right.
So we can take that route, or we can take hey, I just want to get my swing looked at, get my body looked at. Maybe they're younger, more in shape, and it's like, hey, I don't have pain, but I want to be able to swing better or hit the ball further. So then we offer some packages of certain visits that they can come in, and we do more like one-on-one. I call that more like performance training. So we offer performance training or super speed training.
Okay.
That's another kind of aside that I use as well, where we work on like swing speed and how far you can hit the ball essentially. And that's something I've done with some people in the past that they've loved it, been really successful. And my boss, actually, his playing partner, he was like, "Hey, my playing partner in league is not very good. I need you to work with him." And we got his swing speed up, over like 20 miles an hour more than when he was working with me. And so I think they won their league this past year, maybe. I'm not going to say it was me, but maybe a little bit. So
it's a team effort.
Yeah.
If that was what the difference was, right?
Absolutely.
You don't have to,
What percentage of your practice would you say is golf related?
We were talking about this earlier. It depends on the time of year. Yeah. So it kind of comes in waves. The springtime, I would say it's definitely more of a golfer heavy caseload. I would say it fluctuates anywhere from 10% to 30% of my typical caseload.
Yep.
But yeah, in the springtime when it's like, hey, I haven't swung a golf club in a few months, it's a little stiff. Like, this doesn't feel how it used to feel. What can we do about this?
Who's your favorite? Not favorite. Who's your ideal client? If you could build your whole practice around one client, who would it be? Age, sex, desired outcome, pain management, performance management. What do you like doing the best?
I love variety, so it's hard. I think my favorite client changes, right? So if I see too much of one thing, I'm like, all right, give me something new, right? So like in terms of my golfers, like I love my 50 to 70-year-old guys that are close to retirement or right on the edge. They play in their league, and it's like, I just don't have it like I used to. And then seeing them go from, hey, their hips barely move, they can't hardly twist, and then they're like, hey, I did these exercises and they really worked. Like that, I love that. But then not golf specific, I really like my post-op patients.
Yes.
Because, somebody is at a really low point with pain, have a lot of knee pain, for example, and then they finally take the step to get their knee replaced, and they come to me with like, hey, I'm in a lot of pain. I can't hardly move my knee. You take them from basically ground zero to back to doing all the things they want to do in life. I like that a lot because you see a lot of progress over the course of, just a couple months.
How many years are you in practice now?
A little over 2.5.
Okay.
So
because about 6 years, it was probably closer to 10 years ago, Governor, there was this big opioid crisis in Ohio, and they passed some legislation that made physical medicine, chiropractic, physical therapy, all of those people moved to the top of the heap because of the opioid addiction that had been created. And so probably, I know chiropractors have seen a big boost in their initial intake of people. Probably you guys have too, because you're not prescribing drugs, right?
Correct.
You're working around that to get people more functional and less dependent on their medication.
Absolutely. Yeah.
100%.
A lot of times what I'm trying to do is, especially post-op, like, hey, I want you to be off these as quickly as possible.
Sure.
Right? Like, yes, to some extent we need to use them after an operation to help keep pain manageable. Yeah. But yeah, I'm like, let's try and get you off these, and movement is medicine is what we say. So that's what we're trying to do.
And so many people have sedentary lifestyles, sedentary jobs. They're driving a desk all day or they're driving a couch all night or whatever. And so movement is kind of a foreign conversation for a lot of people until they need help.
Correct.
We see that every day as well.
Oh yeah. That's the tough part, is trying to change the mindset and almost like the lifestyle of certain people, where it's not just, oh, hey, do these couple things and it's fixed and it's gone forever. A lot of these things are recurring things. So you have to really kind of shift people away from that sedentary kind of mindset. And something I've started doing a lot is like, the moving more throughout the day. Our phones track everything, and our watches and everything. So it's kind of eye-opening when I have people open up their app on their phone. And it's like, let's track your steps. Like, what did your steps look like?
37.
Yeah. And it's like in the hundreds, it's like, oh, wow, we need to get that up a little bit. Obviously I'm up on my feet all throughout the day, but mine's maybe a little bit higher than most people, but we want it at least in the thousands, right? That's how your body's moving, starting to operate more optimally, rather than, rely on the couch or the desk chair and that sort of thing.
Yeah. Oh my gosh. I'm sure. Are they shocked when they see it?
Oh yeah. And some people are like, oh, there's no way that's right. And I'm like, okay, well, now that it's there, let's track it over the next week. And they're like, oh man, maybe it is kind of that bad.
you look at it the following week when they come in.
Oh yeah.
You said they're
Phone's a
accountable.
tattletale.
Yeah, so
It's
they're
a daggone
accountable.
tattletale is what it is.
Yeah.
So, but it's a good tool though, because then it helps hold people more accountable, and it gives them an objective thing to, oh, hey, now I have this that tracks this. So let me actually start to use this. So it's a good way to kind of get them to shift that mindset rather than, oh yeah, I walked today, like, no, well, your phone says you didn't. So,
Okay. Are you better at giving advice to other people, or are you better at taking your own advice?
oh, PTs are the worst at taking their own advice. Like we know, like we'll get aches and pains and I'm like, oh, I know what's going to help this. But I'm like, if it gets bad enough, I'll start to work on it, or,
So your own personal routine, how many days a week are you exercising?
I'm doing some sort of movement every day for sure. With, like I mentioned, we have a lab at home. He's a year old, so he needs a ton of exercise.
Oh, yeah,
so
that's
I'm
perfect.
at least 30 to 60 minutes a day. I'm walking him, trying to do some sort of lifting, 2 to 3 times a week if I can get to it, if my schedule allows. And then my wife and I. Oh yeah,
that's a horrible phrase.
Oh yeah, I know, and I'm bad at taking my own advice.
He sets your schedule,
right? Yeah, it's not me or anything, right?
No.
But yeah, and then like my wife and I were always going out doing stuff, staying active. So my wife hates the cold, so this time of year it's more me walking the dog, not both of us.
Yeah.
But yeah, I mean, I'm doing something every day to try and stay moving for sure.
Yes. Strength training? Do you do any strength training?
Yeah. I try and make mine more specific to like my golf.
Yep.
So if I've got time at the end of a clinic day, then, I just use the equipment in the clinic, a quick like 25, 30 minute workout, work on my specific things I want to work on, and I'm good. So
And that's really, it's only that, 20 minutes a day.
Yes.
You can, in 15, 20, maybe 30 minutes a day, you can make a huge impact.
100%. And that's, the guidelines that are set out by, like the higher level, the American Society of like Health and Fitness and all that, they only recommend 20 to 30 minutes, 2 to 3 times a week of resistance training. A lot of people think like, oh, it has to be every day, an hour a day. It's like, no, 20.
You don't need fancy clothes. You don't need fancy equipment. You just need to move.
Yep. And consistently, that's the big thing.
Yeah, for sure. So you mentioned that you don't use really any supplementation, so you're getting all of your nutrients from your meals. So what would a average meal look like for you? Say dinner.
Yeah, so I do most of the cooking. My wife's starting to. She's like, hey, I want to get more into cooking, so we're trying new things. But I mean, usually our meals we got some sort of protein, whether it's chicken, beef,
right,
something like that. Then we're going with obviously we got to have vegetables in there. Those are important.
What's your favorite?
Oh gosh, I think it depends. I kind of go in cycles. If I had to pick my favorite, I love Brussels sprouts.
Okay.
Those are some of my favorite.
So how do you cook them to make them taste good?
So I bake them first, and then I'll throw them in the air fryer for a few minutes to make them a little crispier on the outside. I never used to like them, and then we started getting them as appetizers at restaurants.
Yeah.
Okay.
And we started to cook them kind of like that with like some sriracha sauce. So
A little balsamic vinegar,
Yep.
maybe.
Yes. So, but yeah, I mean,
good for you.
Oh yeah. But I mean, that's usually what we're some sort of protein, some sort of vegetable. That's generally what, our meals look like.
Yeah.
And then when I get time to eat lunch throughout my busy day, right, it's usually like it's a quick salad, something like that, just to give me a little energy throughout the day. I eat a lot of like protein bars, protein shakes, throughout the day as well, because those are quick and easy. So, but yeah, I mean, supplement wise, like, I haven't found the need to use a whole lot at this point.
Well, supplements
old are
should be
you?
supplements.
Yeah.
How old are you?
How old do you think I am?
I'm a horrible guesser.
27.
Yes, I was going to say 30-ish. So, but yeah, you still think you're bulletproof.
Oh yeah,
You
for
don't
sure.
even know yet that
Oh
you're not
yeah,
bulletproof.
no, I've heard once it's 30, it's just like downhill from there. All my patients tell me
40.
that.
50 is the new 40.
60.
Yeah.
60.
Yeah.
We're going to go with that.
Oh my God.
So you
Oh my
keep
God.
going with the foods that
I
you
think I
eat.
got
That's the
shoes
best
older
way.
than that.
Yeah. Yeah, absolutely.
One of the things that you mentioned was how overwhelming medical information can be for people, for
Yes.
the clients that come into you, and how you like to try to help them unlearn some of the things about pain. And so what would be a conversation that you'd have with them?
Yeah, so it really depends, because whether they get information from even other PTs, right? Like it can come from anywhere, social media, other providers.
The internet has been a boon for people
the
getting tons
internet's
of information
terrible.
they don't need.
Yes. And so it gets hard when you explain something to someone and they immediately have a preconceived idea of, well, that's not right, because I watched this video earlier that said the opposite. Or
Yeah.
I saw a TikTok.
Yeah. And I don't know about you, but at least for us as physical therapists, like we are doctors, right? So you guys are doctors. But a lot of patients don't hold us as in high of regard as their surgeons or their primary care doctors. And so I think a lot of that is we kind of have to combat maybe some of the knowledge they get from other providers that they say, well, you're just a physical therapist. And we have to kind of educate them that, well, I call us the primary care providers of your musculoskeletal system, right? We know more about how the body moves and the muscles and joints and everything like that than I would argue almost every other provider. So we have to kind of first unteach them maybe some things that they've learned that aren't necessarily true or has been debunked by more up-to-date research, and then teach them like, this is actually what we use now, or this is what the most up-to-date evidence says. Right. And I think, just to give a quick example, like the most common thing is imaging, x-rays and MRIs and things like that. People come in, oh, the doctor said my x-ray is the worst they've ever seen. It's bone on bone, and degenerative disc disease. They hear all those scary words and they're like, well, I'm just destined for back surgery. There's no way I can get better. Wow. But in reality, like as we age, we get wrinkles on our skin, we get gray hair. That's just the same thing that just happens on the inside of your body. But we can't see it actively happening until we get pain, and then we get an image and the doctor's like, oh, this is the worst thing I've ever seen. And it's like, that could have been there for the last 15 years and we just didn't know about it.
By the time you can see any arthritic change on an x-ray, it's at least 20 years old. It's got to be at least 20 years in the making before it's visible on any kind of imaging.
Absolutely.
And so, I always liken that to cavities. By the time you know you have a cavity, it's been cooking a long time. And that means that fixing it may be a little bit more of a process than you think. You can't just go get a new spine or a new knee or, let's see what we can do with what's there before we automatically assume they got to go carve it up.
Yeah, absolutely. And that's, it gets difficult to teach people those things. And sometimes it's not a 5-minute conversation. It's like, hey, I know I'm going to be seeing this patient for, at least a few weeks trying to treat what's going on. And some people just aren't as receptive that first day. So it's just in small chunks, you kind of lead the horse to the water and hope that they drink kind of thing. Yeah. But we have, in addition to like some of the golf certifications I have, all of our clinicians at Xcel, we have a pain neuroscience education specialty, I would call it. And so essentially that helps us to teach people better about their pain.
Sure.
And so we have, examples of posters and different tools that I use in the clinic to bring them over, like I'll bring it right over. Here's what the evidence says. I just taught a patient today, actually, if we brought 100 people into a room that had no back pain, and we did an image on their spine, 40% of those people would show some sort of degenerative change or disc disease, but they have no pain. And most patients are like, oh, that's kind of weird. I didn't know that. And it's like, so just because you have it doesn't mean that's the cause of your pain. So, we like to use a lot of those tools and some of that education that we had, and it really helps they're like, oh, you kind of see that light bulb go on, and it's like, okay, there we go. So
I'm amazed at how, sorry, go ahead.
No, I was just going to say, it is an unlearning process. They have to unlearn some of these things, and then you can feed them new information, right?
Exactly. Yeah. And some people just aren't open to that. Like some people are just set in their ways, and that's okay. And you kind of just, hey, I'm going to do my best for you and maybe teach you in a different way that helps you better understand. And that's kind of the harsh reality. I've only been practicing for 2 years, right? You kind of realize like you want to save everybody,
change the world.
But you have to kind of accept like I can help who I can help. And there's some people that maybe I'm not the right person for them. And,
or maybe they don't want that much help right now.
Yes.
They might not be ready for those changes.
Because people have to be ready for change, especially if it's kind of that lifestyle or mindset shift. And if they're not ready to kind of take on that new mindset, then it can be a little challenging sometimes.
For sure. What were you going to say, babe?
Find yourself over-explaining things?
Oh, all the time. Yep. I always tell patients
talking too much.
Oh yeah, I'll tell them like, just tell me to shut up if I've said this before, because I probably already have.
And I will tell you, the more gray you get in that beard, the less talking you will have to do.
Yep.
Because right now you're justifying some things to people who may or may not want to learn. You're right, and you got to start from where they are.
Yes.
I'm amazed at how people have been just led to believe that they're not smart enough to know how their own body works. Like, let's talk about some things that you already know. You're smarter than you think. And I'll never know your body as well as you know it.
Yeah.
You know where it's been, you know what it's lived through, you know what it does every day. And so you got to kind of figure out where they're starting from. And then another really nice question is where you want to go. Where do you want to end up? So, and they're just people.
Yeah.
We're all ignorant. We're just ignorant about different stuff.
Yeah.
Or we're smart about different stuff.
Well, we're smarter than we've been led to believe. And the bodies that we're living in are way smarter than we've been led to believe.
Absolutely.
So it really is just a matter of teaching and sharing information that lets them grab on.
Yeah.
And did you guys talk about the fact as far as collaboration and things like that, the educational part of, do you do outside talks for people too?
Yeah,
Okay.
definitely. So we haven't done as many as recently, just with after COVID and everything that kind of shifted things.
Yeah.
But we do a lot of, or we have in the past, we bring the community in or bring former patients in, and we do, sort of in-service learning kind of things for them, or we teach them about different topics about their body or things we see a lot of. We've done with like sports teams, like ACL prevention screenings and things like that. So it kind of depends on, what we feel like we're seeing a lot of at that time or what patients need.
Yeah.
We've even had a primary care doctor come in and talk to patients about like diabetes and diabetes management.
Nice.
So trying to again, that mindset and lifestyle shift, not just, hey, we just work on the physical stuff. No, it's all connected somehow, right? We need to make sure everything's kind of in line and in tune with each other.
To optimize, if they're ready to optimize, they need to be looking at all those things.
Yes.
And for when they come into your practice, you're that first layer, right? It's like, we'll start here and then we can
You're the
add
safest.
on.
You're the most conservative option
build.
they have.
Yeah,
you can always
for sure.
take more dope. You can always have another surgery. You can always get more aggressive. But starting with things that are conservative, even from a post-op or a rehab standpoint, conservative is always the best place to start.
Yes.
So I'm super into peptides.
Okay.
And so I'm wondering if you use any peptides in your practice, like BPC 157 or PDA
So
or copper peptides.
I have not used them or recommended them.
Okay.
Only because I don't like to recommend things if I've not done enough research on them. I've had some patients recently start to ask me about them though.
Okay, yeah.
So I've started to dip my toe into, okay, what's this about? Because
Yeah.
you hear it once from somebody, it's like, maybe this is a one-off. You start to hear it 2, 3, 4 times.
Yeah.
It's like, okay, this is a new thing I need to start looking into. So I specifically have not, but I'm open to learning more about it for sure. Yeah.
It's fascinating to me.
Yeah.
I think because people's guts are so messed up, using injectable therapies overrides that assimilation.
It just bypasses the need for digestion.
And goes right to work. We've been using those for several years now, and have had really good results from it. Yeah.
And if I'm, I know the letters and numbers get a little confusing, but is this the same stuff that recently, I know like the MMA and like UFC fighters, they use a lot of that for like recovery. Is that?
Oh yeah.
Okay.
Oh, 100%.
Because that's where I had a patient ask me about this. He's like, oh, I saw the MMA fighters use this. Maybe it'll help me recover quicker from my rotator cuff surgery. And
It
I was
absolutely would.
I don't want to tell you yes or no because I don't know enough yet. But
And good on you for knowing that.
Yes.
It's easy to pretend to be smarter than you are.
Yeah,
and
it's like,
best
let
to
me
just
do
be
some
like,
homework.
I don't know.
Yes.
If you don't know, you're just being honest. I think that's brilliant.
yeah, I think patients appreciate the honesty too.
100%.
Like not even just with supplements, but if we get people that come in and I genuinely I don't know why they're having pain. You know, like there's some people that it's just complex and I'll just tell them, I don't really know what's going on.
Right.
But we're going to figure it out. Here's what I found today. And let's just move forward from here. We'll kind of go with the flow and change as needed. And people kind of gain that trust a little bit. They're like, okay, hey, at least they're honest. They're not just feeding me lies and things like that. So,
and a lot of times where you feel discomfort and where it's actually coming from don't match.
yes.
Right? Like your smoke detector might be in the bedroom, but the fire might be in the kitchen.
Right.
Is that the majority of the time? Do you?
I would say 80% of the time.
Yeah.
You feel that way too?
Where we locate it and where it's actually originating don't match.
Yeah. I think so. I think I educated a lot of people on like something I see a lot as referred pain. So, hey, just because it hurts here doesn't mean it's coming from here, right?
Well, you could have a heart attack and let your arm would be the first clue.
Yes.
Right? So where it's coming from and where you're feeling it don't always match.
Pain is complex and we're still like learning as we go. So I try and tell people that is, hey, everyone's a little different and maybe you're someone that just feels something differently than my typical patient and that's okay. But pain's complex, the body's complex, and we're doing our best. That's why they call it practicing medicine and not, professionally, using medicine or things like that. It's hey, we're literally practicing.
Yeah, it's not cookie cutter. Everybody's a little different.
Yes.
And we practice on ourselves first, don't you think?
Oh, 100%. Yeah. It's like all the stuff that I have those late night thoughts of, what about this exercise or what about this thing? It's like I'm either doing it myself or doing it with one of the other PTs. Like, hey, what do you think of this? How does this feel? And kind of get feedback from each other. But
so you guys collaborate amongst your 4 offices?
Yeah. Oh, yeah.
Weekly, monthly, some kind of meeting maybe we get together?
So we do like in-service once a week where we're, another clinician or an outside clinician is coming in to talk to us about, here's the latest evidence about this intervention or this diagnosis. How are we better able to help this type of patient? So we're always like trying to learn and grow and, from each other. We're always collaborating. We're still a pretty small company overall, like Xcel as a whole. We maybe have no more than 30 total physical therapists. So it still gives us that kind of small, like close knit kind of family feel, which I think I love that a lot.
Nice.
Like especially around holiday times and stuff, we're a close group and that helps us to really feed off of each other, I think, in the energy and just trying to help, the Dayton community, help everybody that we can. So.
Nice.
So when a patient starts with you, do they stay with you? Or do they work with the other practitioners there too?
Yeah. So at least in my clinic specifically, that is the case for right now, just because I'm the only full-time PT in my building at the moment. We're growing quickly though.
Yeah. You said you're just adding somebody in, right?
Yeah. Somebody's kind of coming in part-time hours to help us out. Most of the time we try and keep it pretty consistent between 1 or 2 therapists.
Okay. Just
because then I've heard patients go to other systems and they end up seeing a different therapist
Too many
every
cooks
time.
in the kitchen.
Yeah,
exactly. And nobody's following.
Yeah, there's no accountability.
Continuity of care.
But both by the patient and by the provider, because you see a patient that's seen someone different every time. And instead of, hey, I'm going to really take the time to listen to this person and figure out what's going on, they're like, well, let's just keep it the same. Let's just keep doing what we're doing, hope it gets better. Versus it really allows us to dive in and kind of bounce ideas between 2 of us. Hey, what are you seeing with this patient? And sometimes I like doing that I'm kind of struggling with this patient. Like, why don't you go see, my partner, Kevin here,
right?
Let's see what he thinks is going on. He looks at things maybe a little bit differently than me and patients really like that as well. And
agreed.
Sometimes they just vibe a little bit better with a different person, their personality, and they're like, hey, actually, I'm going to stick with Kevin. Okay, that's great. I don't take offense to that. It's like, that's totally fine with me. So
your goal is to help the patient.
Exactly. It's all about what they need and what they want. And if that's the best for them, then that's the best for them.
Tell us about your hours. When are you there? When can we find you?
Yeah. So for right now, when it's just been me, Monday, Wednesday, Friday, I'm there as early as 7, and we usually leave like early afternoon, like 3 o'clock or so. Tuesdays, Thursdays, I'm there at 9, and then I'm there a little bit later till usually about 5:36. As we bring someone else on, that'll kind of fill the gaps of we'll basically be open 7 a.m. to about 5 or 6 p.m. Just to make sure that, with PT, you're seeing us a little bit more frequently than just your typical doctor. So, you're seeing us once or twice a week. So it's a little bit harder to work around your work schedule. So you can see us before work, see us after work, see us on your lunch break.
Yeah.
Do I need a referral to come to you? Do I need my medical person or some authoritative figure or can I just walk in?
Yeah. So most people can walk right in. If you're gonna use any like federally issued insurance, whether it's Medicare, TRICARE, Medicaid, you do need a doctor's referral. But if you're commercial insurance, whether it's like Blue Cross Blue Shield, United Healthcare, we can see you direct access. You can come right in. We can tell you what's going on. And the good part about becoming a doctorate program was that it allowed us to do direct see patients direct access.
Nice.
So then we can identify like, hey, this isn't a PT thing. You actually should go see a physician to get this looked at further. So
that makes sense.
Yeah.
So Monday through Friday, don't need a referral. You do take some insurance, any and all?
Yeah, we take pretty much all insurances. There's a select few that we don't take, which if people can find that on our website, which insurances we take. And then we also have the option if you don't even want to use insurance at all. We have just normal self-pay rate, where you come on in and we can not even put insurance in the equation. We don't have to answer to them. We can do whatever you need. And I like that a little bit more because that allows us to, hey, we don't have to check these boxes for insurance. We can, hey, today it's my shoulder, but tomorrow it's my knee. That's great. We can do both.
Yep.
Oh, nice.
Insurance only lets us work on one thing at a time. And
I don't know how we let this happen as a nation, but it's a train wreck.
It is. Yeah, it's
frustrating.
Train
wreck. Well, good for you for knowing that. Only 2.5 years into the game.
I know.
If you've got that part figured out, you're already ahead of the game.
Yep.
Perfect.
Yeah. What else do you want us to know?
Well, I want to know what the playlist is at your office.
Oh, that's a very good. That's a hot topic at the office, actually.
Is it really?
It
Who
is.
decides?
So,
You or Ted?
that's definitely me.
Okay.
Definitely me.
Okay.
So my biggest gripe when I started in our Vandalia office, they were way behind the times. I hope you don't use Pandora here, but they used Pandora, but they used it in the worst way possible.
How?
So
How do you goof that up? That's like free beer. I can't goof that up.
Trust me, that's what I was wondering. So the playlists they used were so small, like 20 to 30 songs, and it was very specific to a genre. There were so many songs that got ruined for me because we would hear the same song over and over and over. And so I was like, when I go to Fairborn and we open this new clinic, we're never going to hear the same song twice. So
In the whole day.
Oh, yeah. Oh, for weeks we won't hear the same song.
So what service are you on then?
So I use Spotify.
Okay.
And so I use that, and then other people make playlists and you can just use other people's playlists. So I'll cycle between some like office upbeat playlists or like all genres, like top 500 songs of all time.
Yeah.
And usually these playlists will last for 2 weeks at a time.
Okay.
So I love it because we can go from, country music to classic rock to like Frank Sinatra, literally all in like 3 songs in a row. And some people are like, what is going on? Like, am I hearing this
so
right?
confused,
Yeah.
yeah.
I'm like, well, it
keeps their brain working.
Yes, for sure. And I just get so bored with like one genre. So, and there's not really a specific type of music that I'm just like married to. So I'm like, hey, it keeps it fun. Most of the songs are upbeat, while people are working out in the clinic and that sort of thing. So my playlist changes, but it's very all encompassing for sure.
Diverse.
Yes.
Nice. You want to talk about your playlist, babe?
No, because I use Pandora. But it's commercial free, and I don't pick an artist. I pick a genre, or I'll use the artist to play the genre. So you won't usually hear the same song twice in a day.
You don't usually have any lyrics that come through.
I prefer instrumental music. Yeah.
Maybe I just had I have a bone to pick with Pandora unintentionally. I think maybe it was more the people in Vandalia responsible for the music just didn't use it to its full capacity.
Right.
Yeah, I love it. But I'd be a good Amish person as well. So at the end of the day, but yeah, I don't want commercials. And here's a weird thing. This is back when I was not in charge of the playlist, but my mentor would just put it on like a radio station. And so you would get drug commercials, you would get, goofy window washer commercials or whatever. But I was working with somebody and a song came on the radio that reminded me of a girlfriend that I had in high school. And I could feel my physiology changing while I was working on somebody, and it was not good. And so I knew right away, first of all, you got to get your hands off of that person. And second of all, we got to get this playlist under control because music is powerful. It brings back memories. It sets a tone and a pace. It can sometimes upbeat, sometimes not. But at the end of the day, I want instrumental music because I don't want a song coming on my music box that reminds somebody of a negative event in their life. So we just kind of play it in neutral, sometimes uptone, sometimes jazz, sometimes, but you probably won't hear lyrics most of the time. And if you do, it's probably not English. It might be French, it might be Italian.
Whatever works. Yeah. No, it's interesting though. I mean, like working with people in pain, there's correlation between certain scents
100%.
or
you
music
put on some
or
Ozzy
songs.
Osbourne and my ears hurt immediately.
Yeah, it's so it's crazy how those things can tie in with those pain experiences.
You
And
better
someone's in
believe
your office and they're like, "Oh, my knee hurts a little bit more than it did when I came in here." Right. So that's a good thought though, for sure.
Yeah, I try to keep it neutral.
Scent?
Oh yeah.
Scent. Yeah. So do you guys have a fragrance-free office then?
Oh goodness, I don't know that we have. That's something I need to look into. So being the only one there, and well, we have 2 of us there, and we're both guys. These are not things we think of. So I'm glad we're talking through these things. We need to start thinking about that.
Yeah, it does make a difference because it can trigger headaches. It's definitely an endocrine disruptor. So anybody
Perfumes and fragrances, and like Glade plugins and all
never
that
use
trash.
Yeah.
Bad idea.
So I'm assuming you guys use some sort of something here.
We use an ionizer just to keep the air clean.
Okay.
Yeah. So if you're going to smell anything, it's going to be like a fresh rainstorm.
Okay.
But no fragrance otherwise.
Okay.
Right. And
smells are powerful.
toxin-free soaps and things like that.
Okay.
So people don't go home with
perfume.
Yeah, for sure. I mean, you do still have patients that come in that.
Oh yeah, you can tell if somebody hugged you with a perfume
I can smell.
bottle on.
Oh yeah.
It's crazy to me how long that lingers. So just things we've learned along the way.
Yeah, absolutely.
My hair salon actually is a fragrance-free salon of all things.
Yeah.
But I think it's becoming more commonplace now.
Yeah.
That people are, even posting. My craniosacral therapist, she is like, if you wear perfume, I'm going to decline your care for the day.
Oh wow.
Because they've been forewarned that this is important to her.
Policy.
In her policy, yeah. So just different things like that. It's very interesting.
Yeah, I think we're becoming more aware of like what's in our food,
Yeah.
what are we breathing in, and
Right.
So I think it's good to start to look into these things
Absolutely.
of like healthcare. There's a lot of different factors that go into it, and these are just. They may seem like small parts, but they definitely play a big role. So
For sure. And it's an easy shift, right? And it doesn't, you're going to still be getting something or maybe not. But yeah, environmental toxicity is a big deal.
Yeah.
And it's something that we do have control over.
Yes.
And that's cool.
To some extent.
Yeah.
Yeah.
In your own space, you do for sure.
Right.
Yeah.
Yep.
Yeah.
I'm looking forward to some future
I know,
collab.
it's going to be so fun.
I'm looking. We'll have a spring training session. We'll bring you in and talk to our golf community. We got a ton of golfers in here.
Yeah. They do a golf outing every other year.
yeah.
Yeah.
We just invite the whole practice and we just go play golf for the day. And feed them and prize them and have a great day. So we'll look forward to it. You're the new guy in town, but we'll look forward to getting old together.
That's right. Yeah, there we go.
That's super fun. Anything else that you'd like for the audience to know?
No, I mean, I think you guys really covered a lot of it, like where we're at, when we're, when we're open, the things we offer. I guess maybe to go a little bit deeper into like who we are as Xcel. So backstory is our founder is from South Africa. And so he came over and started Xcel around 20 years ago.
Oh, wow.
And so he took a lot of non-Western principles and used that to create Xcel. He saw the way American medicine was practicing, especially physical therapy, and was like, this isn't right. We need to change this. And so a lot of the things that we do are more like hands-on manual therapy based, which I know is somewhat common in the US for physical therapy, but not a lot of, some places you go and they just give you a list of exercises and just go do it.
Yes.
Right. So a lot of our philosophy is if you're in pain and your body's not moving correctly, well, how would I expect you just to come in and just move and do it correctly, right? So we do a lot of manual work. We're working on, muscles, joints, trying to get those moving better, try and reduce your pain. Once we get you moving better, then we can, now your body's moving the way it should. Now let's go reinforce those patterns that we just created and with some exercises so we can prevent this pain from coming back. So I think that's kind of how we differentiate ourselves from other practices in the area. And it gets hard because there's so many PT practices to choose from. And so, finding a place that, that maybe does it a little bit differently and it kind of goes outside the norm, kind of like we do, I think is helpful. And, more important than anything, like we're here to help you. We're here to listen to you. And so, listening to what they have to say, I think is like number one on our priority list. And then, we kind of go from there. So
I love that. Thank you for differentiating what you do compared to other offices, because I wouldn't have known that. I don't know. I didn't know what
Part
to
of the deal.
expect.
Yeah, we're looking for,
Yeah, absolutely. And I think it gets hard in healthcare too to choose a provider, right? There's, again, not just with PT, but there's so many options and kind of the influx of information gets a little overwhelming. And that's kind of what we, are intending to do is, give you a care that is more focused and hands-on. We're not a clinic that sees 4 patients at the same time and just has multiple people in the gym working with a college rehab tech that's getting paid $10 an hour, right? Like we're there with you, we're doing the things with you and making sure that, you're getting the best care, the top level care that most people deserve. And that's the unfortunate part with the healthcare system and the insurance is in order to make money, you got to see all those patients, but we feel like we found a way that allows us to still be there with the patient, do the hands-on, the stuff that really matters that you can't just do on your own with videos on YouTube, and then incorporate, yes, exercise is still an important piece of that, and also bringing that in as well to make sure that we see you through to the end. We're not just, hey, fix your pain while you're here, and then we don't have any follow-up to that. So
Yeah, that's awesome.
Yeah.
That sounds like a really good model of care.
Yeah, absolutely. And that's what I think keeps a lot of our clinicians at Xcel is our model is just different than most places. It allows us that freedom to, specialize, see what we want to see like golfers, but then also really spend the time that the patient deserves. And I think that really sets us apart. So I think that's why, I would argue that, we're the best PT in Dayton. So, and I'll fight anybody on that for sure. But I think we have good reason for sure. So
good. Oh, that's awesome. I love the pride that you have in your company. Yes, that's the way it should be.
Definitely.
Yeah, that's awesome. Because the patients are going to heal better and faster because of your attitude.
Yeah, absolutely.
Absolutely.
Yeah. Expectation is one of the biggest things when somebody walks in. It's like, do they expect they're going to get better or do they not expect?
Yeah.
If they expect that, hey, this is going to help, then they have that positive expectation. Usually we're going to see a positive outcome. So
I love it. Yay. Well, thank you so much for being here with us.
Thank you guys for having me.
Yeah, it was super fun.
I knew it would be.
You did know it was
I knew it would be. What do you want people to do? Let's say they liked what they heard and or saw. What would they do? They can like the episode. They can subscribe to our channel, and they can share this episode with a friend, somebody who needs what Scott Blackburn has. Perfect. Yeah. Thanks, everybody. That's it. All right. See you next time. Bye.